All right, we're diving straight into a really complex medical condition today. We're going to break down systemic sclerosis, a disease that, get this, can actually turn the body's own healing process into a weapon against itself. So, let's start with a medical mystery. What could possibly connect symptoms that seem totally unrelated? You've got cold, discolored fingers, really bad acid reflux, and then this process of internal scarring. How on earth are those three things related? Well, it turns out they can all be clues pointing to a single culprit. So let's get right to it. What exactly is systemic sclerosis? Okay, so at its heart, systemic sclerosis is a rare autoimmune disease. That's where your immune system gets confused and starts attacking your own body. And in this case, the attack comes in three main forms. You've got vasculopathy, that's just a fancy word for blood vessel damage. Then there's inflammation, and finally, the big one, fibrosis, which is where the body creates way too much scar tissue, both on your skin and inside your organs. You can really think of this as a chain reaction. So, step one, imagine a crack forming on the inside of a pipe. That's the initial injury to the lining of a small blood vessel. Because of that damage, a blockage forms, which is step two. And that blockage cuts off the oxygen supply to the surrounding tissue. Then comes step three. The body, trying to be helpful, rushes in to repair the damage. But it completely overdoes it, producing a ton of collagen and causing all that excessive scarring we call fibrosis. Okay, so we know what happens, but the big question is, why does it happen? What kicks this whole destructive process off in the first place? Well, it's not just one thing, it's more like a perfect storm. On one hand, you might have a genetic predisposition, certain genes that just make you more susceptible, but that's usually not enough. On the other hand, you need an environmental trigger. This could be something as common as a viral infection or even a reaction to certain drugs. It's when those two things, the genes and the trigger, collide that the disease can really take hold. Now, here's something you need to know. Systemic sclerosis isn't a one-size-fits-all disease. It shows up differently in different people. And doctors usually classify it into two main types, based on how much of the skin is actually involved. So in the limited form, that skin thickening, the fibrosis, is pretty much just on the face, hands, and the lower parts of your arms and legs. But with the diffuse form, it's much more widespread. It hits all those same spots, plus the trunk, so we're talking about the chest, the abdomen, and the back. And knowing this difference is super important because it helps doctors predict which internal organs might be at risk down the line. So you can see how with all these different symptoms and types, actually diagnosing this can be a real puzzle for doctors. It's a true diagnostic journey. And this quote just says it all. I mean, just imagine having what feels like really severe acid reflux. You could go through procedure after procedure, seeing specialist after specialist for years, thinking it's a stomach problem. And then you find out it was an early sign of systemic sclerosis affecting your esophagus all along. This disease can be a true master of disguise. But doctors have this amazing and kind of low-tech trick up their sleeves. One of the biggest clues can be found in a place you would never, ever expect, the tiny little blood vessels at the base of your fingernails.
Yeah, seriously. They use a special microscope to look at those capillaries, and what they see can tell them so much. In the early stages, they might spot a few capillaries that are way too big. They call them giant capillaries. As the disease gets more active, those capillaries get all twisted and dilated, and you might see tiny little spots of bleeding. Then, in the late stage, the capillaries just start to disappear altogether. It's like having a tiny window right into the core of the disease.
Okay, so once the diagnosis is in, everything shifts to management. And treating systemic sclerosis is, well, it's like walking a tightrope. It takes an incredible amount of balance. So the main goal is to get that overactive immune system to just calm down. And they do that with immunosuppressant drugs. But that's not all. Doctors also have to be on high alert for really serious complications. For instance, there's a life-threatening kidney issue called scleroderma renal crisis. If that happens, a specific type of blood pressure medication, an ACE inhibitor, can literally save a patient's life. But this is where that whole treatment tightrope thing gets really, really real. Because there's one type of medication you have to be extremely careful with. And here is the critical warning: steroids. Now, you'd think steroids, these powerful anti-inflammatories, would be a go-to for an autoimmune disease, right? But not here. In systemic sclerosis, high doses of steroids are a huge no-no.
they can actually cause that same life-threatening kidney crisis we just talked about. It's a perfect example of why managing this disease is such a delicate balancing act.
And really, that brings us to the central paradox of this whole condition. The body's natural response to an injury, to heal and create scar tissue, is the very thing that drives all the damage. It leaves us with a really tough question. How do you manage a disease where the body's own attempt to heal itself becomes its greatest enemy?